But the first question we get is, am I required to enroll in Medicare when you turn 65? We're seeing more and more people working past their 65th birthday into their late 60s. And a lot of people have this misconception that you have to enroll in Medicare when you turn 65. And that's not always the case. If you fall into one of the 5 scenarios on your screen, if you're no longer working, if you're on COBRA insurance, if you are on TRICARE, or a small group employer plan, that's an employer plan with 19 or fewer employees, or if you're on a marketplace plan under the Affordable Care Act, then it is in your best interest to enroll in Medicare. However, if you're still working and your company has more than 19 employees on the plan, then you do not have to enroll in Medicare. And actually, if you're contributing to an HSA account, you do not want to enroll in Medicare Parts A or B. If you're not contributing to an HSA account, I do advise you to enroll in Medicare Part A. That just gets you into the system. For example, we're working with a gentleman now whose name was misspelled on his Social Security card, and that's preventing him from getting his Medicare in a timely basis. So if you're not contributing to an HSA account, go ahead and enroll in Part A. There's no harm. It doesn't cost you anything, and it'll get any minor concerns out of the way before you absolutely need coverage. So then for those of you who are not on Medicare, as you approach your 65th birthday, you have a 7-month open enrollment period, your initial enrollment period. It runs 3 months before your birthday month, and then 3 months following your birthday month. Now, if you're still working and you delay Medicare, when you leave your group employer plan, your employer is going to have to fill out a employment verification form. That form does 2 things. First, it creates a special enrollment period for you to now go and enroll in your Medicare Parts A and or B. And second, it tells Medicare that you had creditable coverage from a group plan, and therefore a late enrollment penalty will not apply. So that's your initial enrollment period, your special enrollment period for getting onto Medicare Parts A and B. Once you're on Medicare, every year between October 15th and December 7th is the annual enrollment period. And this is a time for you to take a look at your coverage, make sure the coverage that you had for the current year is still the most appropriate coverage for you in the following year. And the important key there is to look at your prescription drug coverage, because that can change from year to year. And then finally, there's an open enrollment period that runs from January through March for anyone that is on a Medicare Advantage plan. So if you're on a Medicare Advantage plan, you get into the new year, and for whatever reason, the plan that you chose during the annual enrollment period doesn't work for you, you have a one-time opportunity to make a change. By far, the easiest way to enroll in Medicare is through your online Social Security account. And if you haven't already created your account, go to ssa.gov and create a login me account. It can take some time. It can take 20, 25 minutes to do it. You will need access to your cell phone and your email, and you may have to use your cell phone to upload a picture of your driver's license and then take a picture of yourself. If you are already collecting Social Security, you will automatically be enrolled in Medicare Parts A and B 3 to 4 months before your 65th birthday. And this is important to know. If you're already collecting Social Security and you're working and you want to delay Medicare, you need to reach out to Social Security and let them know you wish not to have it. But for most people, as you approach your 65th birthday, as you retire from work and go on Medicare for the first time, you're enrolling online. That is the easiest way. And of course, you can call Social Security and create an appointment for your local Social Security office. Before I get into original Medicare, what Medicare covers and does not cover, do we have any questions on the enrollment periods or how to enroll? That stuff's pretty basic. If you do have questions, reach out.
I have
Yep.
one question, Andy. That is with the shutdown, and if we're coming up against those 100 days, are you aware whether the website is functioning normally, or whether there are issues, or can you still get an appointment with Medicare?
That is a great question. The government shutdown does not affect Social Security. Social Security is actually administered from its own trust fund. So therefore, the government shutdown is not as big of a ramification. Now, there are some things that you won't be able to do during the shutdown, but you can enroll in Medicare. You can change your plans during the annual enrollment period. There are no problems with that. You can apply for your Social Security, and your Social Security checks will continue to come. What I advise folks right now, especially during this time of year, is you want to give yourself some extra time, because while the Social Security Department is still processing and still working, not affected by the shutdown, there may be other government entities that they rely on for information that could slow the process down. Great,
Thank
great
you.
topical question. You're welcome. Um, so we hear this thing called original Medicare, Medicare, the ABCDs of Medicare. What does all this stuff mean? And I think what makes Medicare confusing and complicated, first, we approach Medicare kind of like the way we approached the registry of motor vehicles back in the 80s, right? We have this mindset that it's going to be confusing, it's going to be complicated, and it's going to be stressful. And then we get all the mail from the insurance companies, and the information overload confirms what our conception of Medicare is. And when we get that amount of information overload, our brains just shut down. So if we just start at a very basic level and just understand what Medicare covers and does not cover, and then that there are two ways for you to fill in the gaps, Medicare can actually be pretty simple. Um, this screen right here sums up what Medicare is. Medicare Part A covers your inpatient hospitalizations. Most of us do not pay a premium for Part A. Medicare Part A is going to cover your inpatient hospitalizations, but the important thing to know is there's a deductible per occurrence. Currently in 2025, that's $1,676. The 26 number should be out in the next 3 to 4 weeks, hopefully. What that per occurrence means is if you're hospitalized multiple times, you may be on the hook for multiple 16 plus $100 deductibles. So we need to fill in that gap. The other important thing to understand about your Part A coverage is Medicare is only going to cover skilled nursing, things like rehab or home health care, if you have been hospitalized for 3 full consecutive 24-hour inpatient days. And then when you are covered for skilled nursing, Medicare will cover the first 20 days at no cost. And then there is a copay for 2025. It's $209.50 per day for days 21 through 100. And then you're on the hook for the full amount, days 101 and beyond. So we need to fill in those gaps. That is what Medicare Part A is, your inpatient hospitalizations. Medicare Part B covers things like doctor's appointments, lab work, durable medical equipment, pretty much all your Medicare covered expenses outside of an inpatient hospitalization will be covered by your Part B. Currently in 2025, the base premium for your Part B coverage is $185. If you're still working and your income is higher, you may pay more than that. And that is actually based off of your income reported 2 years prior. So what's important to know is if you retire and you're a high income earner, your your Part B premium is going to be assessed and determined to be a higher amount in that year. However, if your income has now dropped because you've had a lifetime change, a lifestyle change in your employment, you can apply and ask for a redetermination. Um, so that's important for folks to know. The other thing to know about Part B, after a $257 annual deductible for 2025, Medicare is only going to cover 80% of your doctor's bills. You're on the hook for 20%. Now, unlike your current group coverage when you were working, there's this thing called a maximum out of pocket in your group plan. That doesn't exist in your Medicare Part B. So your 20% could be as high as your healthcare needs are in any given year. So it's important to cover those gaps. When I say that's what Medicare is, that is really truly what Medicare is. That's what we refer to original Medicare. So the gaps that we're filling in for would be your Part A deductible, perhaps the skilled nursing copay, and then the Part B 20%. The other gaps that people look to fill within their Medicare is dental coverage, vision coverage, Prescription drug coverage is actually a separate plan. There's two ways to get it. And then, of course, you're hearing, and if you haven't already made plans for long-term care, it may be too late. Medicare is not going to cover long-term care coverage. And by the time we get into our mid to late 60s, if we haven't already put that into place, two things happen. It's either prohibitively too expensive, or you may not pass medical underwriting. So just know that there really is no coverage for long-term care under Medicare. Before I get into the two ways to fill in the gaps, do we have any questions on what original Medicare is and what those gaps are that I talked about? All right, so we need to cover those gaps in one of two ways. The first way, commonly referred to as option one, is a supplemental plan or a Medigap plan. We use those words interchangeably. And then the second way is what you hear about Medicare Advantage, otherwise known as Part C. So let's break each down. And after we break each down, I'm going to give some highlights as to when you might go one option versus the other. But first, when we discuss option one, you're staying on original Medicare Parts A and B. So you're going to have the Part B premium, base premium, $185 paid to the federal government, and then you get a Medicare supplement. You're supplementing Medicare to fill in the gaps. And those gaps specifically would be the Part A deductible and the Part B 20%. Now, if we go this way, we still need to fill in the gap for prescription drug coverage. So we get a separate prescription drug plan, Part D. And then if you want dental or vision, we fill that in. And then there are also some other plans that you may want to include in there with recovery care, again, to fill the skilled nursing gap, or cancer coverage. The nice thing about this option is you can see any doctor, any facility in the country. You no longer need to worry about doctor networks. The other nice thing is after you make that additional monthly premium, your out-of-pocket expenses when you do go to the doctor or the hospital are very much limited. So you have a lot of freedom and a lot of flexibility. Now, I noticed there are a couple of folks from Massachusetts. What I have on the next two slides does not apply to you in Massachusetts. Most of the country uses a schematic of Medicare that's the same across 46 states. You might hear of a Plan F, a Plan G, or a Plan N. For those of you that are dialing in from Massachusetts, we don't use that schematic. We have a core plan, a Plan 1A, and a Plan 1. And the other key thing to know about Massachusetts, our supplement plans in Massachusetts are guaranteed issued no matter when you apply for it. And they are also community rated. What that means is regardless of when you apply for a Medicare supplement plan, you're guaranteed to be covered, and everyone with the same insurance company and the same plan pays the same rate regardless of their age or their health status. That's not the case in the rest of the country. In the rest of the country, if you decide to go on a Medicare Advantage plan or decide just to have Medicare Parts A and B when you first go on Medicare, if you want to apply for a Medicare supplement plan later on in life, you're going to be asked medical underwriting questions. And the insurance company can charge you more money or deny your coverage based off of your current or past medical history. So outside of the states that have guaranteed issue like Massachusetts, the best time to enroll in a Medicare supplement plan would be within the first 6 months of joining Medicare Part B. Again, across the country, supplement plans are pretty much universal. A Plan G in Florida is the same as a Plan G in Georgia. A Plan N in New Hampshire is the same as a Plan N in any other 46 states. So let's take a look at those plans. For our Massachusetts folks that are attending, our Massachusetts Plan 1A is pretty much a Plan G. And when we look at Medicare supplement plans, we're really looking at a Plan G or a Plan N. Your Plan G is going to cover 100% of the Part A deductible. So if you're hospitalized, Medicare is going to cover your bill minus $1,676. And then your Medicare supplement plan is going to cover that $1,600 deductible. Your Plan G is also going to pay 100% of the Part B coinsurance. That's the 20%. And the only out-of-pocket expense you have on a Plan G is going to be your Part B deductible, the first $257 of your doctor's appointments. Now, on a Plan N, we look at this. That's going to cover 100% of your Medicare Part A deductible if you're hospitalized. It's going to cover, it says here, 100% of your Part B coinsurance. There's three asterisks there, and you can see here on the blue side here, copayment. Under a Plan N, you will have a small copayment when you go to the doctors or when you go to the emergency room, that type of stuff. The other thing to know about Plan N is the doctor can charge you what's called a 15% excess fee. If the doctor can charge you a little bit more than what Medicare pays, that is rare. It's extremely uncommon, and not most people never see that excess charge. Because Plan G is covering a little bit more, it typically does cost a little bit more. And we are expecting that the Plan N premiums over the next 2 to 3 years will be a little bit more stable. We anticipate higher premium increases in Plan Gs across the country. Any questions on supplemental plans?
Yes. Quick question. So you mentioned that it's different for states like Massachusetts. Where can we find out the idiosyncrasies of Medicare for Massachusetts?
Just about everything you read online, including on Medicare.gov and in the Medicare and You book, does not apply to Massachusetts. You'll see there's a little asterisk there. Probably the best way is to reach out to an independent broker, to get on one of the insurance company websites, or to reach out to the Massachusetts Division of Insurance. They can help you as well. Yeah.
Thank you.
But literally everything you read online about supplement plans really doesn't apply to you if you're in Massachusetts. All right.
Terrific.
So the nice thing about it's a good thing because we're guaranteed issued. And I'll talk a little bit about that when we talk about Medicare Advantage and which way you go. So the nice thing about the supplemental plans, you have freedom and you have flexibility. You can, regardless of who the insurance company is, you can go to any doctor, any facility in the United States that accepts Medicare. And then your out-of-pocket expenses are very limited depending on which Medicare supplement you're on. So the insurance company doesn't matter. Where the insurance company might matter is their historical rate increases, as well as how they're managing their claims. Your second way of filling in the gaps is this animal called Medicare Advantage. And this is where most of the marketing comes from. And it's also where the majority of the disruption in the Medicare space during this annual enrollment period lies. We've all heard the TV commercials. I don't know what the TV commercials are going to look like this year. They'll probably be somewhat different. But historically, the TV and radio ads have gone something like no monthly premium, no copay for your PCP, no deductible, free dental, free vision, free hearing, free transportation, free meals, free this, free that. And while that ad might be accurate in what it's saying, I think the impression it leaves on you, the consumer, is somewhat distorted. It either leaves an impression of it's too good to be true, or it leaves an impression that everything's free. So the first question becomes, how is it possible for a Medicare Advantage plan to offer you coverage at no monthly premium? Now, Medicare Advantage is private insurance. It's managed care. It's very similar to the type of insurance you have when you're working. The way there's no monthly premium, and the reason we say no additional monthly premium to you, instead of saying it's free, is because we know nothing's free. Basically, the way it works is, and I'm going to make up numbers for sake of illustration. The Medicare Advantage insurance company is basically going to the federal government and saying, hey, Social Security, hey, Medicare, based off of our calculations, it's costing you, the federal government, $5,000 to provide the Medicare Part A and B coverage to these folks. We believe if they join our Medicare Advantage plan, we can manage their care for $3,000. So the government says, fantastic, if they join your Advantage plan, we'll pay you the $3,000. The Medicare Advantage insurance company's happy because they're getting paid. The federal government's happy because they're saving $2,000, and they're no longer managing your claims. So it's not that it's free, it's that you're using the federal government as a pass-through. The $185 Part B premium you're paying, the FICA taxes that everyone's paying, is going to basically the Medicare Advantage company to cover your premium. So then the question becomes, how is it possible for an Advantage company to manage your care for less than the federal government? And they're doing it in two different ways. Just like your group employer insurance company is going out to all of the doctors and hospitals and inviting them to participate in their network, when they agree to participate in their network, they're agreeing to a negotiated set of reimbursement rates. Some doctors agree to those rates, other doctors do not. For that reason, we have HMO and PPO networks. Now, within an HMO network, you have to stay within that insurance company's list of doctors in their network. Under a PPO plan, you have the ability to go outside and see somebody that's not in that insurance company's network. But because that insurance company doesn't have a negotiated rate with that out of network doctor, they're likely paying a higher rate. They're going to pass that on to you in a higher copay than if you see an in network doctor. So Medicare Advantage companies work very similar to your current plan, your current employer plan. Um, there's a copay when you go see a specialist. There's a copay for an X-ray. There's a copay for a hospitalization or emergency room visit. So it does actually replace Medicare Parts A and B. You do still have to pay that Part B premium. One of the reasons why people decide to go on a Medicare Advantage plan is for the ancillary benefits, things like dental and vision that aren't included in original Medicare. And what I say to folks is it's nice that the plans have dental and vision or maybe an over-the-counter benefit or a free gym membership. You need to make sure the health insurance side works first and foremost. Um, it's nice to have those extra benefits, but nobody loses their home over a root canal. So we must make sure the health insurance works for you first. And then the other thing is the Medicare Advantage companies kind of got a little irresponsible with some of the ancillary benefits. And what we're seeing now in the disruption is they're starting to pull those benefits back, especially on PPO plans. The other thing that I like to talk to folks about is cancer, heart attack, and stroke coverage, specifically cancer. Regardless of whether you go option one or option two, we always recommend a standalone cancer plan because Medicare is not going to cover everything. Specifically on a Medicare Advantage plan, majority of Medicare Advantage plans, you have 20% co-insurance for chemotherapy and radiation. And then even if you're on a supplement plan, Medicare or your Medicare Advantage plan will not cover experimental treatment, may not cover expensive non-FDA approved drugs. And then again, I go back to Medicare is only going to cover home health care if you've been hospitalized 3 full consecutive inpatient days. What that means is if you're not responding well to chemotherapy or radiation, you need help at home, a home recovery plan can help fill that gap. So we talk about protection plans, home recovery, hospital indemnity, specifically on Medicare Advantage plans to cover the major exposures in your coverage. So the question becomes, which way do we go? Do we go, if we're still working, do we stay on our employer plan? If we're no longer working or if we're retiring and we go on Medicare, do we go on a supplement plan or do we go on an Advantage plan? Before I get into what that decision tree looks like, I just want to stop for a moment and see if there are any questions on either supplement plans or Advantage plans. Perfect. Now, if you're still working, the decision over Medicare or an employer plan really comes down to a cost benefit analysis. The first question I ask is, what is your income? Because if you're higher income, the higher your income is, the higher your Part B premium will be. And if your Part B premium now starts to get pretty expensive, that could actually be more than what your employer group coverage costs. So the first question is, what is your income? The second question is, do you have a younger spouse or any other dependents on your group plan? Because if you leave the employer plan to go on to Medicare, you now need to take into consideration what does the health insurance cost, and what is the coverage like for those younger dependents? And then the third reason why you might choose an employer plan over Medicare, if you're on pretty expensive brand name prescriptions, typically that coverage is more affordable under the employer plan than what we can get under Medicare. However, that dynamic is changing now that Medicare has introduced a maximum out of pocket for prescription drug costs. So I already talked about this a little bit. The higher your income, a younger spouse, expensive drugs, your employer plan may be the most appropriate for you. But if your income is currently, if your income is less than 212,000 as a joint filer or 106,000 as a single filer, Medicare is probably going to be the more affordable option for you. But it is worth it to do that side-by-side cost-benefit analysis. All right, so we've made the determination that we either want to go on Medicare or we have to. Question becomes, do you go with a supplemental plan or do you go with a Medicare Advantage plan? And when it comes to this decision, for most people in most states, again, Massachusetts, New York are not included in this, the part of the decision has to be an understanding that if you decide to either go on a Medicare Advantage plan or just carry Medicare Parts A and B, if you want to go on a supplement plan later in life, you will be subject to medical underwriting. So that needs to be part of the consideration. But outside of that, what type of person should be on a Medicare supplement plan or would benefit most? The type of person that is has a chronic injury, chronic illness, someone that is predisposed to routine and frequent care. You're going to the doctors every month for tests. You have a history of multiple hospitalizations throughout the year. The reason for that is when we take a look at what your premium, your annualized premium is for your supplement plan, and we compare it to the estimated copays under a Medicare Advantage plan, your Medicare Advantage plans may have a max out of pocket as high as $6,000, $7,000, $8,000. So if we think you're going to hit that max out of pocket, then a Medicare supplement plan may actually be more affordable. Plus, you're spreading your cost over equal 12-month payments versus getting that copay bill every time you go to the doctor. The second part is if you live in multiple parts of the country and have care providers in each, and I'll add to that, if you live in a part of the country where access to care might be challenging, not a lot of doctors in your area, then Medicare Advantage could be a challenge for you because you may have to stay within that Medicare Advantage company's network of providers. So in that situation, if your doctors are not all in one plan, care is sporadic and spread out among geographic areas, the Medicare supplement may be the most desirable option. And that's because you can see any doctor, any facility across the country. You no longer need to worry about doctor networks. And then I hit upon this as well. Doctors are not in network for your HMO or PPO Advantage plan. And that is something for the 50% that are currently on Medicare. If you're on a Medicare Advantage plan, you do want to check your doctors for next year because we are seeing a lot of changes in doctor networks from this year into next year. And then the third situation, we see people gravitating to a supplement plan versus an Advantage plan. If you're not worried about running out of money in retirement, the supplemental plan gives you a lot of freedom and a lot of flexibility. And a lot of people like that aspect to their health coverage. So when would a Medicare Advantage plan be a suggested path? For someone that's healthy, not using their coverage, certainly somebody in a state like Massachusetts where our supplement plans are guaranteed issued no matter when you apply. In a state like Massachusetts, if you can get 3, 4, 5 years out of an Advantage plan, you might be able to save yourself $10, $15, $20,000 over that time period. Very easy to move on to a supplement plan later on in life. That's not the case in the rest of the country, though. In 46 other states, if you go on a Medicare Advantage plan and then 4 or 5 years later your healthcare needs change and you've developed a critical illness, a chronic injury, you're now predisposed to frequent care. If you then try to get onto a supplement plan, you're going to be subject to medical underwriting. The insurance company could charge you more money or could decide to deny you coverage. So Medicare Advantage can be a good suggested path for somebody that wants to try to save money up front, but understands that if something happens, they might be on the hook for co-pays and co-insurance up to a certain maximum amount. Insurance is all about understanding your risk and managing your risk. Can we eliminate the risk of a health event happening? We can't. We can reduce it though. We can eat healthy and exercise and all that stuff, but we cannot eliminate the risk. Can we absorb a health risk? Meaning, can we go without insurance and pay the bill ourselves? Um, for anyone that's ever seen a hospital bill, we can't absorb it. So then can we transfer that risk? In transferring the risk is where insurance companies come in. So under a supplemental plan, you're saying, you know what, I'm willing to pay a premium to transfer nearly 100% of my health risk to an insurance company. Under an Advantage plan, you're saying, you know what, I am willing to assume a little bit of risk, that max out of pocket, $5, $6, $7,000, because I want to try to save some money up front. So by saving that money up front, you're assuming that risk later on. The other reason why people gravitate towards Medicare Advantage plans is because they like the idea of the ancillary benefits being built into one plan. If you remember my slide about supplemental plans, we had that kind of triangle, if you will, where you're paying multiple people. Under the supplement plan, you're paying the federal government, you're paying a Medicare supplement insurance company, a third payment to perhaps a second insurance company for your prescription drug coverage, and then fourth and fifth payments for dental, vision, etc. Under the Medicare Advantage plan, a lot of that care can all be built under one plan. On prescription drugs, if you've ever heard of the donut hole went away starting in 2025. As part of the Inflation Reduction Act, a max out of pocket on covered prescriptions was introduced. For 2025, folks on Medicare with prescription drug coverage will not pay more than $2,000 at the pharmacy for their covered prescriptions. In 2026, that's increasing to $2,100. There are several places you can go for Medicare advice and enrollment assistance. You can do this on your own. Medicare.gov has a very good plan finder tool where you plug in your zip code, your prescriptions, and starting this year, you can even plug in your doctors. And that's going to give you a good idea of the plans available in your area. You can use across the country SHIP counselors, or here in Massachusetts, a SHINE counselor. That's someone who volunteers their time to help you understand how to enroll in Medicare or what might be the most appropriate plan for you. You can call the 800 number on the bottom of your TV screen. I think that's probably the least desirable method. And then you can also use a company captive agent. That would be an insurance agent that only works for one company. And then there are folks like myself, independent brokers. Now, if you go it on your own, you can make some mistakes. It can be confusing and complicated. If you use a volunteer, that person might give you good advice up until the time you enroll, but that person cannot help you post enrollment. Same with a call center, and then with a company captive agent, somebody that only works for one insurance company, you're only getting information on that one insurance company's plans. So if that's the way you go, you're going to need to call each insurance company in your area. And then in independent broker, the guidance I give folks on independent brokers is you want to select an independent broker that represents multiple insurance companies. Ask them, how many plans, how many insurance companies do you represent? The other thing is independent brokers, it's against federal laws for an independent Medicare broker to charge you a fee for Medicare advice. So we're paid by the insurance companies a commission. On the supplemental side, we're paid somewhere between 18 and 22%. On the Medicare Advantage side, we're paid the same regardless of who the insurance company is. That's a rate set by the federal government. And there are some Medicare Advantage plans that do not pay brokers a commission. So that's a question you want to ask as well. Are you giving me advice for a plan that you're only getting paid on, or are you also considering plans that are non-commissionable to you? Before I get into my process, do we have any questions on which way you might go or where you can go to find help? I'm going to share with you my process, and if you go to Medicare.gov, this should be your process as well. The first thing we do is we input your drugs into our software. what we're looking for is we're looking for either the Medicare Advantage plan or the standalone prescription drug plan that gives you the lowest annualized cost premium plus your estimated copay at the pharmacy. So when you go into Medicare.gov, you're going to want to make sure the plans are filtered by total lowest cost. Um, you want to look at what is the annualized copay and what is the annualized premium. And generally speaking, that's the plan that we're going to look at. Now, if it's a Medicare Advantage plan, you need to add in a review of your doctors and pharmacy access to make sure your doctors are in network. And then we compare all the plan options available in your area. And Medicare plans are pretty much different by county. So your zip code is important to plug in when you're comparing plans. Things that you want to be looking for, obviously, what is the monthly premium? What is your cost sharing structure? Co-insurance, co-pays on prescription drug plans or Medicare Advantage plans? What is my maximum out of pocket? What are the other ancillary benefits that are important that come along to it? Again, word of caution on the ancillary benefits, make sure the health insurance works first and foremost. And then we help folks enroll. Now, while independent agents and company captives cannot help you specifically with enrolling in Medicare Parts A and B, we do sit with folks, do Zoom webinars, and walk them through the Social Security website, helping them apply for A and B. Once you have your Medicare number, your independent advisor can help you enroll in the supplemental plan or in the Medicare Advantage plan and help ensure that that enrollment is accurate and timely to ensure there are no gaps in your coverage. And then we reevaluate plans every year. We're also in assistance throughout the year for prior authorizations, or if something's not being covered, what are the alternative options for getting that covered, as well as just helping you understand how to use all the features in your plan. So I like to say it's a partnership for your health coverage and financial wellness. Again, I believe Medicare is the intersection of your health coverage and financial wellness. The first phase is attending an educational event like this one, going back and watching this when the time comes, um, looking at your Medicare planning guides, asking questions. Does this apply to my state? Schedule a free consultation with, I believe everyone should be working with an independent broker. Of course, I'm a little biased by that. But you don't pay the broker anything, and you get the same plan at the same cost with the same benefits, whether you use a volunteer, do it yourself, or do it a captive company agent. And then, of course, your independent agent should be available to you throughout the lifetime of your plan to help with billing or claims issues, as well as doing those annual reviews. Um, Folks, that's really all I have prepared for you. I would like to open it up for discussion. Happy to have folks come off mute and have some interactive questions. Sometimes when we get questions, if they're more personal in nature about your health, um, we don't, I don't like to discuss people's personal health situations, but I will give you a high level perspective on that.